Hello everyone. So let's very quickly discuss about the femoral triangle, a very important topic. So here on the left side of the body, you can see I've drawn femoral triangle here. A triangle is, you can see triangle very clearly. And here on this side, I've drawn the triangle, but you can't see the triangle. Is the base, is the floor of that triangle. So that will be relevant for the boundaries, which we will discuss in a moment. So here's the femoral triangle. Let's talk about the boundaries. Here on the superior aspect, you can see inguinal ligament. Yeah, a ligament from your anterior superior iliac spine going towards your pubic tubercle. Yeah, so this would be your superior. This would be your superior boundary would be inguinal ligament, whereas your lateral boundary of this femoral triangle, lateral boundary would be your sartorius muscle. Yeah, this is the sartorius muscle, a very long muscle. And on the medial aspect of this triangle, we will have a muscle named adductor pollicis, no, adductor longus. Yeah, so on the medial aspect we have the adductor longus muscle. So these are the boundaries of femoral triangle. Now let's talk about the roof and the floor of the femoral triangle, because uh, since it is a triangle and it must have boundaries and roof and your base also and floor also. So let's talk about the floor of the femoral triangle. Now floor of the femoral triangle, you can see uh, on the medial aspect of the femoral triangle floor, we have a muscle, same muscle, adductor longus. Adductor longus, why adductor? Because these are the one, they adduct your thigh, yeah. And then you have on the in the middle of this floor of the femoral triangle, we have the pectineus muscle, yeah. Here's the pectineus muscle in the middle, and most laterally on the floor of this femoral triangle, we have iliopsoas muscle, yeah. So here is the iliopsoas muscle. We have a tendon also of the psoas tendon, but for the exam purposes, it's important just to remember iliopsoas muscle over here. And this is all about the floor of the femoral triangle. So we are done with the boundaries. Lateral boundary, sartorius. Medial boundary, adductor longus. Superior boundary, inguinal ligament. Talking about the floor, we have again adductor longus. It was boundary, medial boundary also, plus it is the medial boundary of the floor also, adductor longus. We have pectineus muscle and we have iliopsoas muscle. So we are done with boundaries and we are done with floor of the pectin of this femoral triangle. Now let's talk about the roof. Now roof, of course, we would have from top to bottom, superficially going towards deep. We would have skin, we would have subcutaneous tissue, then we would have superficial fascia, and then we would have deep fascia. Deep fascia in the thigh we can also is also named as fascia lata. Yeah. So again, roof would be skin, subcutaneous fat or superficial subcutaneous tissue, you can say, or then comes superficial fascia, then it comes deep fascia, yeah, also named as fascia lata. Now here in the diagram you can see I've drawn a triangular shaped. This is this is present. So triangle is as a whole. In the triangle we have this femoral sheath. Yeah, this is a fascia layer which is covering, which has few important structures passing through it. Yeah. So let's zoom and let's discuss about the femoral sheath present in this triangle. Yeah. So it's a kind of a canal of fascia which is present in the femoral triangle. Yeah. So femoral triangle itself is a kind of a space, and it is very important for the surgical standpoint of view. So here is the femoral sheath I've drawn. This one is on the right side, right femoral sheath. Here it is on the left, but this one is on the right femoral sheath. Now here what we can see in the femoral sheath, there are few structures passing through femoral sheath. As we know, a very famous mnemonic, navel, yeah. N for nerve, A for artery, V for vein, and E is for empty, and L for your lymphatic, yeah. So nerve is the one, femoral nerve is the one which is not inside the femoral sheath, yeah. inside this fascial layer, yeah, fascial canal. So your nerve is not passing through your femoral sheath. This is one important point, very very important point. Then we have then we have the artery here passing through femoral artery. Along with the femoral artery, we have genitofemoral nerve, yeah, femoral branch. They both are in one compartment. This one is the lateral compartment. Then we have the middle compartment. In middle compartment, we have mnemonic V, yeah, NAV. So V is inside the femoral sheath, inside, and it is in the middle compartment of the femoral sheath. Now vein is the one, and here is your great saphenous vein also getting inside into your draining into your femoral vein. Yeah. So this one is the middle compartment of the femoral sheath. Then let's talk about the medial compartment. The medial compartment here with the mnemonic EL, naval, yeah, so EL, lymphatic, and the lymph node of the cloacaid is also present here, yeah. So these are the lymphatic, yeah. So this is how it's done, naval. Important, very, very important point to remember is nerve is the one which is not inside this femoral sheath, yeah. Nerve is outside, lateral to this femoral sheath. So it's all about the from lateral to medial, naval, yeah, nerve, artery, vein. Your it's empty. Empty. We are referring to empty space. Why is it empty? Why is it called empty? Because this area is needs to be empty. It has lymphatic also, but it is empty because if vein needs to expand, suppose this vein gets expand, there need to be an empty space. So this is very important clinical point or surgical point for why is it called empty in this mnemonic, because empty needs to be, there should be some space for the vein. Suppose vein gets expand, yeah, so there needs to be some space for this vein to venodilate if it needs to. And now this area, the most medial part where your lymphatic was present or empty, this is your femoral canal, yeah. So this is your femoral canal, this area. In femoral canal, as we know, is the most medial part and itself is present in the femoral sheath, yeah. So femoral canal is the one through which your lymphatic passes, your lymph node of cloacaid is present, your lymphatic passes through your femoral canal. So this area, you can see, this area is your femoral canal. Above this, and this femoral canal itself is a continuation of your femoral ring. So above the inguinal ligament, you can remember like this: above the inguinal ligament, it is femoral ring. Below the inguinal ligament, it continues as femoral canal. So it's the most medial part. So here you can see, here's the femoral ring. Femoral ring is the upper part above or above and behind your inguinal ligament. So boundaries of the femoral ring would be, since it is behind the inguinal ligament, so anteriorly inguinal ligament would be present. Then we have the lacunar ligament. Lacunar ligament is the most medial part. Over here is a ligament present on near the pubic tubercle, and here is another ligament going through. Here I have drawn very dark. This is pectineus ligament. It is a continuation of your lacunar ligament. Yeah. So these three ligaments. So the medial boundary of your femoral ring would be lacunar ligament, and inferior boundary would be your or posterior boundary would be your pectineal ligament, and anterior boundary would be your inguinal ligament, and your lateral boundary would be your femoral vein over here. Yeah. So these boundaries are important, very very important. One must know femoral, and this is femoral canal. Femoral canal is itself is nothing, is just a continuation of femoral ring. So many students get confused with femoral ring and femoral canal. So here's the it's just a continuation, and femoral canal is the one which contains the mnemonic E and L of the mnemonic navel. Yeah. So this is whole as a femoral sheath. Yeah. And nerve is the one, femoral nerve is the one which is outside your femoral sheath. The most lateral compartment of this femoral sheath would have your femoral artery, and your femoral branch of your genitofemoral nerve. In the middle compartment, we have saphenous vein and femoral vein. Saphenous vein draining into gray saphenous vein, draining into your femoral vein, and most medial part we have femoral canal. Femoral canal having empty space. I told you why is it important to call it empty. And the E and L we have lymphatics, yeah, deep lymphatic tissue. Sorry, deep lymphatic nodes, yeah, and for example, clocket node and lymphatics passing through these. So these femoral sheath is very important, and femoral sheath itself is inside your femoral triangle, yeah. And inside femoral triangle, we have femoral sheath, and inside femoral sheath, we have femoral canal. Yeah, so these structures must be remembered. So here are the boundaries of the femoral triangle: inguinal ligament, adductor longus, sartorius. Floor I talked about pectineus, adductor longus, medially and iliopsoas laterally, and roof, skin, subcutaneous tissue, superficial fascia, deep fascia, fascia lata. Femoral ring is the entry to your femoral canal, which I already said, already discussed, and boundaries of inguinal femoral canal, femoral ligament, femoral ring, as I already mentioned. Anterior would be inguinal ligament, medially it will be lacunar ligament, posteriorly it would be pectineus ligament, and laterally it would be your femoral vein. Yeah, so this is all about the femoral triangle. All right, very, very important topic. One must go through it all the time before the exams. Thank you.